Hello, wonderful students. Myself, Dr. Maddineni, Srinivas, Dermatology faculty from Bharat. So, in this video, we are going to look at basal cell carcinoma, which was asked as a theory question in the RGUHS examination. The etiology and the clinical features are going to be discussed in this video. You should know what is the other name of basal cell carcinoma, but before that, you should know that BCC is a locally invasive malignant tumor, which is rarely going to show any metastasis. Because it is a locally invasive tumor, it is going to produce ulceration of the skin, and the ulcer is going to appear as if a rat has eaten away the skin. So that is the reason why this is also called as a rodent ulcer. It is a locally invasive malignant skin tumor which will not show any kind of metastasis. Very rarely it will show metastasis. This is a very peculiar important point for you to write in the theory examination. It originates from the stratum basal layer of the epidermis, and the most important factor associated with the etiology is the ultraviolet exposure, that is the sun exposure. It is the most significant risk factor. There are other associated factors, like for example genetic factors. If you remember, in the Gorlin syndrome, which is also called as basal cell nevus syndrome, there can be multiple basal cell carcinomas in the patient. And in the transplant recipient individuals, because of the immunosuppression, and also those who are undergoing the PUA therapy. Those who don't know what is PUA therapy, I have made a video on that. PUA simply stands for psoralen combined with ultraviolet A therapy. So there are certain indications for PUA therapy. I have made a video, you can check that. I will leave it in the iCard and also in the description. And even the chronic arsenic exposure, I hope you remember from the forensic medicine knowledge, and also radiation therapy is associated with BCC. See, more commonly it is seen in the males because they will go outside to work, and also it will increase, the incidence will increase with the age. So what will the clinical features? So most commonly occurs on the sun exposed areas, very obvious because UV rays are important risk factors. And more frequently the BCC lesions are going to appear over a site which is drawn by a imaginary line joining the angle of the mouth to the pinna of the ear. So as you are able to see here, this is the line drawn from the angle of the mouth to the pinna of the ear. So above this line there is going to be high likelihood of basal cell carcinoma developing. How does it appear? Early on, the lesion is going to be appearing as a pearly white papule or a nodule which will have telangiectatic, that is dilated blood vessels on its surface. In the advanced stage, like I have told you, just like this rat is going to eat away the skin, there is going to be formation of ulceration. And here there is one more description which you should remember. The edges are described as rolled out edges. I hope all of you know ulcers have different types of edges. There can be undermined edges, there can be punched out edges. So remember, rolled out edges is a very classical term associated with BCC. And of course, the because of it is locally invasive, there's going to be ulceration of the skin. Not only that, it can also erode the bone and also the facial senses. Crusting and bleeding can also occur. So there are various types of the BCC, but remember, 3/4 of the time it is going to be a nodular basal cell carcinoma. Like I have told you, there's going to be pearly papule, as you are able to see here in this picture. The surface is going to show the dilated blood vessels, that is a telangiectasia, and ultimately ulceration rolled out. This is all the common thing. And the other types, so you can just remember the types of the BCC. Superficial pigmented. So you can see here there is pigmentation of this BCC lesion, and also the sclerosing variety, and also cystic type of basal cell carcinoma. These are other variants. In the management, remember, the surgical excision is a preferred method because it is going to ensure that the lesion is the malignancy is going to be completely removed, and this surgery name is called as MMS. The MMS, this is not Ragini MMS. The MMS here stands for Mohs micrographic surgery. So this is a very precise surgery where the margins are going to be very meticulously identified intraoperatively, and they are going to be completely removed without any residual tumor cells remaining in the patient's body. And also just remember what are the other therapies. Cryotherapy using liquid nitrogen at minus 196 degrees Celsius. Radiotherapy is also used in some patients. Photodynamic therapy and also topically imiquimod. So this is the topical agent which is available for the treatment of basal cell carcinoma. Remember this. And coming to the prognosis, I have told you already, metastasis is very, very rare. So local recurrence is the only big headache which the patients might be having. High cure rates with appropriate treatment is very likelihood to happen. So that's it in this video, students. I hope all of you have enjoyed this video. Please do hit that like button if you have enjoyed this, and also do subscribe to this channel for more such content on a regular basis. Thank you so much. Happy learning. Bye bye. Sarvam Sri Krishna from Sarvejana Sukhna Bhavantu.